I am a physician and I'm specializing in diabetes. In this video, I'll be talking about microvascular complications. Diabetes affects the normal metabolism of blood sugar, leading to high blood sugar, known by the term hyperglycemia. And the chief target of diabetes is the vasculature system. When the small vessels, the capillaries, are affected, it defines microvascular complications. More often than not, it remains unnoticed for years by you, the patient, and your healthcare professional. This is why I tend to call it the unseen face of diabetes, because it is the root cause of extreme complications such as blindness, end-stage renal disease, and limb amputation. In this video, I will be talking about how can we uncover the invisible face of diabetes and how can we prevent or at least slow these microvascular complications. The first point is screening. I'll be using this term, that means the fact of detecting at an early stage an abnormality within your body, meaning before the apparition of noticeable symptoms, or there are some symptoms and you are unaware of the existence of some kind of disease. The purpose of screening would be, yes, to detect, but also to adjust the overall therapeutic management so we can prevent further complications. Alright, the first microvascular complication is retinopathy. And retinopathy is an eye disease. It is in fact the most common form of eye disease related to diabetes. And you see, retinopathy means the pathology of the retina. And thanks to the retina, we are able to see. If ever it is affected, the vision would be altered. And you might develop symptoms such as blurry vision or seeing dark spots until it reaches the stage of blindness. Indeed, in the United States, around 10,000 cases of blindness are reported each year due to diabetes. But you see, the progression of retinopathy might remain asymptomatic for years. There is no symptom. That is to say, the importance of screening. And what is exactly this screening? Your ophthalmologist or your optometrist or a healthcare professional trained for this technique would use medicated eye drops so he can dilate your eyes or exactly your pupil. This helps to see clearly the retina. He will use an instrument called fundoscopy or further instruments depending on your eye disease. And after this comprehensive eye examination, the examiner is now able to assess at which stage is your retinopathy so he can guide you for further and appropriate management. The second microvascular complication is diabetic nephropathy. And let's use the term chronic kidney disease. And it is also estimated in the United States that chronic kidney disease due to diabetes is the leading cause to end-stage renal disease. End-stage renal disease requires either dialysis or renal transplantation. And of note, chronic kidney disease can seriously affect your cardiovascular health. So let's avoid these extreme complications by the help of screening. The screening is based on a urine test and a blood test. The collection of your sport urine helps to assess what we call the albumin to creatinine ratio, or ACR, and the blood test helps to assess the estimated glomerular filtration rate, or EGFR. These two parameters will help your healthcare professional, so now he is able to know at which stage is your nephropathy and initiate appropriate management. Alright, the third microvascular complication is diabetic neuropathy. And neuropathy means the pathology of the nerve or injury to the nerve. It is estimated that more than half of the patients with diabetes will be developing this condition during the course of their disease. Yes, there are multiple forms of diabetic neuropathy, but here we'll be talking about the most common form, which is the diabetic symmetrical polyneuropathy. Alright, to make it simple, you see the nerves within your limbs, they get injured because of diabetes or episodes of hyperglycemia. And here you can lose the protective sensation within your limbs, and you can develop symptoms such as burning sensation or numbness or weakness within your limbs. But here is the trick. More than half of the patients with diabetes that have diabetic neuropathy are asymptomatic, It means that there is no symptom, no awareness, and the hidden loss of the protective sensation puts them at the risk of wound skin and then foot ulceration, and here starts the path towards limb amputation. And yes, indeed, in the United States, around 80,000 of cases of limb extremity amputations are reported each year due to diabetes. And I believe that these numbers and these statistics might be even more alarming in areas of the world where access to treatment and resources are limited. This is why it can be helpful and really eye-opening for you, dear patient, to receive this screening test. And the screening test is quite simple. It is non-invasive. Your examiner will be using some instruments, for instance, to assess your temperature perception, whether you are distinguishing between the warm and the cold temperature. And for instance, a tuning fork, this instrument, helps in assessing the vibration perception and also how is your perception towards pain. The examiner uses a pin with two edges, with a blunt and a sharp one. And finally, the most common instrument or test, the 10-gram monofilament. So here the examiner can really assess whether you are losing this protective sensation. So you see, overall, it takes like 1 to 2 minutes for the screening test. And here you are able to know what is your nerve status and what to do further. So now that you know more about these different microvascular complications and how to detect them, you might be wondering, when should I go for these screening tests? ADA, the American Diabetes Association, and NICE Guidance, the National Institute for Health and Care Excellence, they recommend for patients who have type 2 diabetes to go for screening at the time of their diagnosis. And if you are having type 1 diabetes, here, 5 years from your diagnosis, the screening should start. And then you repeat on an annual basis, or at least every 2 years, for instance, for the eye examination, as the resources might be limited. But here again, if the initial eye examination was found to be normal. So you see, overall, after the results of this screening, if ever there is a detection of some kind of abnormality, your healthcare professional can guide you for a specific follow-up schedule and an adjustment for your treatment. And this is what brings us to the next point, prevention. The good news is that some robust evidence-based trials demonstrated that it is possible to prevent those microvascular complications. Let's cite DCCT or ACCOR or UKPDS. These large trials revealed quite interesting outcomes in terms of preventing the microvascular complications. So the first approach is glycemic control. And yes, high blood sugar is the leading cause to microvascular complications. And you need to achieve an optimal HbA1c. You know, this blood test that tells you how is your blood sugar control during these past 3 months. So now let's talk about those famous large trials. The UKPDS demonstrated that each time that HbA1c decreased by 1%, just 1%, let's say from 9% to 8%, here the risk for microvascular complications was reduced by 35%. You see, glycemic control prevents but also slows the progression of microvascular complications. Let's take the example of eye disease or retinopathy. In the DCCT, they demonstrated that when HbA1c is reduced by just 10%, the risk that retinopathy progresses was reduced by 43%, which is a great number. So another point in glycemic control is that if ever your screening test finds out that there is some kind of abnormality within your kidney function, here ADA and NICE Guidance recommend that your healthcare professional guides you to initiate some of the novel glucose-lowering agents. And these agents demonstrate great benefits in terms of protecting both your kidneys and your heart health. So to sum up for glycemic control, go for achieving an optimal individualized HbA1c and go for drug adjustment so we can prevent the progression of microvascular complications. So the second approach is blood pressure control. And here I'd like to start by the statement of KDIGO, the Kidney Disease Improving Global Outcomes. It stated that the blood pressure control is a key component in terms of preserving the kidney function. And this especially when the alteration within your kidney function has already started. So here, your healthcare professional would highly suggest to initiate one of the specific blood pressure lowering agents such as ACE inhibitors or angiotensin II receptor blocker. Here again, the large trial UK-PDS demonstrated that when you decrease your mean blood pressure from 144 millimeter of mercury to 144 millimeter of mercury, you see just 10 millimeter of mercury difference, it resulted in reducing microvascular complications by 37%, and especially in terms of eye disease or diabetic retinopathy. So here again, 37% is a great number. So to sum up, blood pressure control is of great importance, and you should target an individualized blood pressure control. It depends on the recommendations, but also your overall health status. Okay, let's talk about the third approach, lipid management. You see, now it is recognized that dyslipidemia, or an abnormality within your lipid profile, participates in the mechanisms that lead to a nerve injury or diabetic neuropathy. So if you take care of your lipid profile, you'd probably take care of your nerve health. And also, some studies are discussing that if you use some specific agent that controls your lipid profile, it can help in reducing the progression of eye disease related to diabetes. So you see the same thing for the kidneys. If your kidney function is affected, here the recommendations are suggesting that you should go on a specific treatment that controls your lipid profile. So you see, we've talked about the nerves, the eyes, and the kidneys. This is to say how lipid management is of great importance in terms of mitigating further complications. As a final approach, let's talk about lifestyle. When we use the term lifestyle, we think about weight management, diet, exercise, smoking, and alcoholism cessation. I'd like to show you how everything is interrelated. And this is exactly what has been demonstrated by the famous trial, the Look Ahead trial. You see, just 10% of weight loss with the help of specific lifestyle interventions, including diet and exercise, it helped in achieving great improvements in terms of blood sugar, blood pressure, and lipid profile. So you see, everything is interrelated. To sum up, dear individual with diabetes, I highly suggest that you ask for your screening on an annual basis, your eyes, your kidneys, and your nerves. You should also collaborate with your healthcare professional so he can guide you to control your blood sugar, your blood pressure, and your lipid profile. You can also find out the lifestyle approach adapted just for you. Thank you for watching.